first half of the year has flown by, and I'd like to take a few minutes to provide an update about our collective progress and achievements in the second quarter. We continue to see strong financial performance with discharge growth of 7.2%, evidencing the growing demand for our services. To meet that demand, we continue to expand our footprint by opening 2 new locations in Florida, a 60-bed joint venture hospital in Fort Myers with Lee Health in May, and a 50-bed wholly owned hospital in Daytona Beach in July. Most importantly, we continue to provide high-quality care, returning more than 80% of our patients to their homes and earning a Net Promoter Score, patient satisfaction, of 76. Our outcomes have never been better. We have a lot to be proud of, and digital channels are increasingly important for communicating what sets us apart and makes us the trusted choice in rehabilitation. We launched a new website in the second quarter, and I asked Liz Moore, Vice President of Marketing Services, and Joy Johnston, Director of Digital Marketing, to sit down with me and share more about it. So, Liz and Joy, before we get into the benefits of the new website, why did we need a new website?
That is a great question, Mark. We really did our homework on this. We did a deep dive into how people were using our website and exploring the platform we were using. In great partnership with ITG, we took a look at everything. And really, there were many reasons we did this. One is that this is our digital front door, and we want people to come in through our front door and have the kind of experience they would have if they were coming to our hospital. But we also looked at technology and patient journey. From a technology perspective, we really needed to upgrade the platform we were on so that we had more capabilities to integrate with new technology that's coming down the road. We had a better opportunity to adapt to AI changes that are happening, particularly in search, and really just to make sure we were maximizing this resource, which is foundational to our communication and marketing efforts. We really want to be able to support our hospitals, so we needed a better platform to do that on. Secondly, we looked at patient journey. It's very important that we align with the patient journey, so when people are coming in through our digital front door, they're coming into the right room. So if you're looking for just general information, that we're serving that up to you easily. If you're looking to make a decision, that we're giving you the information you need to make a decision, and hopefully to find that we're your trusted choice. So looking at all those things together, it just wasn't possible to adapt our website to meet those needs any longer, so we chose to do a new website.
All right, well, very good, very good. So these things are always more complex than people like me like to give them credit for. So, how long have you all been working on this?
Well, from the beginning in earnest with a partner, an external partner, to the day we launched, it was just over 18, 19 months. But really, we've been working on this for 2.5 years, getting ready to do it, doing our assessment. We were very fortunate as ITG and marketing began to look for a partner to build this. We found a partner that actually had experience in working with national healthcare providers with multi-state footprints. So we both looked at what we knew about consumers, what we found from how people used our website, and what they brought to the table to really maximize this opportunity. And it took thousands of hours. It took our content team, our digital team. It took legal. It took ITG. It took people in the field. It took business development. It took all of us working together and our clinical leaders to really come up with a website that we felt would best serve consumers and support our hospitals in our growth initiatives and in just really having that relationship and communication with the people in their communities. So we made a lot of changes based on all of that, from making sure that we listed the visiting hours and the phone numbers, to making sure that we were meeting the needs of the 80% of people who visit our website who are on mobile devices. So a lot of our decisions were driven by that. But I think in the end, it was a lot of work, but it was really worth it.
So now that you've set us up, sell us on the new features. What can employees expect to see with the new website?
So I think what employees are going to see is that it's going to be much more user focused. At the heart of it, we want to make sure that our users are getting to the right information that they need. Based on all of the user research that we've done, we want to make sure that that navigation is very clear and concise so that they can go through the site and really find that service information that they're looking for, or find the location that they're looking for. We also wanted to make sure that as we were building this site, it's a cohesive story. So we pulled our blog content into the main website so we can really tell that brand story to our consumers. And the underlying base of this is SEO, search engine optimization. So
A term I was educated on.
it's at the base of what we do. That's how users find us when they're doing their search. AI search is becoming such a prominent thing in the search world and how people find us. So we're really starting to optimize that content for how search is going to find us.
Good, good. So it sounds exciting. Is there anything else that you want our employees to know about this new website and what it means to them and features that might be available to them?
It's the foundation of what we're doing in our website right now. We're going to continue to optimize this. It never ends in a website. So we're going to continue to optimize it. What we have on the horizon is our Spanish translation. That's important for us. Making sure that that's really, the whole site is translated for our Spanish speaking audience. We're looking at how do we enhance our locations and our local content. And then we're also really focusing on that AI search and how are the AI search engines finding us.
Good.
It is a great platform to tell our patient stories on, to make sure people understand our quality story and all the things about Encompass Health that help them make a good decision when they need care.
Well, this is exciting. I know it's been a big project, and thank both of you for all the work you've put into it. And I know our staff will be very excited to see it and more importantly, to use it in the future. So thank you.
Absolutely. Thank you.
We're laying the foundation for future growth and success in every aspect of our business by keeping an eye to the future, and our marketing efforts are no exception. But the real foundation of Encompass Health is and always will be our people. Thank you for supporting one another so we can best serve our patients, their loved ones, and our communities. Here's to a great second half of the year.